If we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples, the easy way to get prepared for birth. But today I wrote a post on intermittent auscultation that I would love to chitty chat if you guys have any questions about, or you can ask your pregnancy questions too. Is it true to get approved for VBAC? It has to be a special OB-GYN that works with that. No, not usually. That you can't work with a midwife most often. You might be able to have appointments with a midwife, but usually you can't see a midwife if you're a VBAC. They usually can't deliver you because if it became necessary to start a C-section, they wouldn't be able to do that. They can't do a C-section. Do we have any more pregnancy questions? Would love to answer them. So if you're looking for the intermittent auscultation post, it is on the pregnancy nurse, and it just means monitoring the baby less than constantly. I've been trying to get pregnant ever since September, and I'm still not pregnant any trips. So it's been, I think that's longer than 9 months. Average time is 9 months. So, okay, have you been to the doctor? Find anything out about that? Actually, right now, I'm into the online prenatal class for couples. Keep asking your questions to add that post into that part of the class, because I think it's super important that people understand how intermittent can work. Because as a nurse, I didn't really understand it, but I think it can have lots of benefits as I'm reading the studies more. Anybody have questions? Otherwise, I'm just going to be in here. Yasmin, I'm not sure what you didn't get. Let's see. I saw my period 2 weeks ago. It came up for 2.5 days. Is it possible to be pregnant? Take a pregnancy test. If you're having unprotected sex, there's always the chance. Even if you are having protected sex, it doesn't work all the time. So, yeah. Just here working. Yasmin, it is about, I was talking about intermittent auscultation. So listening to the baby, somewhere between every hour to every 15 minutes, just to see how the baby is. And studies are showing that could even be safer um, than others. So much so that I think I'm going to add something about it to my class. So, to get pregnant if you're not using protection, but randomly just have. I don't know that there's studies on that, KK. Any questions, guys? I'm just in here updating the online prenatal class for couples with a little bit more information about how often you need to be monitored with the baby. What can I take? Is intermittent monitoring an option? So as I wrote the post, if you guys read it, you'll find that I was super conflicted while I was writing it, because if somebody came in to me while I was working as a nurse asking for intermittent auscultation, I would be super uncomfortable because it's just not what I was used to. I've never really been trained to do it beyond doing it with some midwives, where the midwives mostly did it. I would chart it, but midwives mostly did it. So, and I think it tends to be done more by midwives than, nurses per se, or by doctors, I should say. So, it should be an option at any hospital if you are low risk. So, as soon as you add an epidural, uh an induction, if you're on MAG, anything like that, then it's off the table. You would need to have continuous monitoring in these places. Just as a nurse, we need to be monitoring your contractions and how baby's doing with Pitocin or the other things. Otherwise, we could lose our license, which you can imagine doesn't sound very fun. So it should be an option. Um, Where Shelley said, "What can I take besides Tylenol for my pregnancy migraines?" I'll ask your provider that one. Sorry. He says, "Thoughts on Cervidil?" I am a fan of Cervidil. However, it has to be placed by an experienced nurse. It is difficult to place well. Um, so I always, if the nurse places it wrong, you just end up wasting 12 hours of your day at the hospital. And so I always, I'm a bigger fan of misoprostol because of that, because there are often so many new nurses that have a really hard time putting it in. It's also more expensive, and it has to be kept in a fridge, which can be problematic on some units in some areas. So, but I've put it in, have really good luck with it. I like the fact that you can pull it out, which you can't do with misoprostol. Once it's in, it's in. So, yeah. Can you move around with continuous monitoring? There are some wireless monitors, Lorian, that you can move around more. But the cords for continuous monitoring are long, and so I'd often put patients by the bedside, or often they have telemetry monitors that you can walk the hallways with, or they have the wireless monitors. Usually, you can still move around, but the problem is, can we get the baby on the monitor in the way that you want to move? So, moving is awesome, but can we still monitor the baby? And so, oftentimes, in order to get the baby, you're left with only so many positions that you can be in order to get the baby. I do intermittent monitoring and love it, but I'm low risk labors with 2 to 3 hours tops, no epidural. Yeah. So that's exactly who it's for, which honestly at the hospital we don't see a whole lot of. There's so many inductions, and if you're being induced, you can't get it. So yeah. No, it's good for all day heartburn. Have you talked with your provider about like a Prevacid or something like that? People are on like the oral pills that you can take for heartburn. So ask your provider about it. Is it true to get approved for VBAC? It has to be OB/GYN. No, it does. Oh, sorry, Yasmin. I did answer this question. No, regular doctors should be able to do it. Midwives can't do it, but any OB/GYN should be able to do it. I think yeah. This is Rico said, "This is my first pregnancy at 12 weeks. Can I know the gender?" Usually you can, but at 12 weeks you can't usually. I don't know if that makes sense, but usually a year later along when you can know the gender. Me said they are planning to start my induction with Cervidil. I'm so scared. Don't be. It's going to be just fine. Just as a nurse, it's something I'm cautious of. Um, yeah. So when they put it, part of the problem is if you aren't relaxed when we're putting it in, especially new nurses get nervous and they just kind of shove it in. So the more you can relax while they're placing it and tell them to take their time, even though that's not very fun during the exam because it's just like regular vaginal exam. We just want to make sure that we get it in the right spot. But if you're tensing up or making it harder, it makes it harder for us. So you can do a part to try and make it easier for them too. Chelsea said she's dealing with kidney stones at 13 weeks. It's been terrible. I had that with my last pregnancy. I'm so sorry, Chelsea. Keep an eye on it though, because it can cause your uterus to get in on the action of contracting, and so keep an eye on it because that can also UTIs or kidney infections. Yeah. So I don't know much about that type of issue with the ultrasound. Some of these I'm just gonna skip. I don't have any information on that. What does it mean when you're dilated 1 centimeter on the out? So it's kind of like your cervix is a funnel. So on the outside, it's 1 centimeter, and then it's closed on the inside. And that's not unusual. Um, really doesn't mean anything, even if you were dilated one the whole way. How can we prevent ectopic pregnancy? I don't know that there's a way to actually prevent it other than not having sex or using protection to not get pregnant. Is there a way to make sure that it's working? Contractions. So, if they put it in and you're not contracting at all, you could ask them to take it out, start misoprostol. Um, it should work with contractions. You should see contractions within an hour or 2 of them placing it. The methotrexate shot, I think, is to absorb the pregnancy. It's not like preventing an ectopic. Do you guys have, let's see. Oh, yeah, atmosphere is very nervous as an understatement. Oh, Brooke, A, I'm so excited for you. And B, the best you can do to chill out is the best you can do. Yeah. It's so hard, but all of pregnancy and parenting can have those nervous feelings. So try and having hope and things like that can really help. Cece, this is not about like I'm not great about getting pregnant. What are my options for kidney stones for pregnant? I have some pretty large stones. I can't pass. I don't know. I was able to pass all of mine, but I know that I have been with patients who went in and got the surgery where a little basket goes up and takes care of the kidney stones. Yeah. If you haven't met, hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And I'm also the creator of the online prenatal class for couples, the easy way to get prepared for birth. In just a few hours, you can feel prepared for birth. You're not going to be nervous thinking about birth. And it's created to do with your partner. It's available 24/7 on demand, so you can do it whenever you want. People call it fun. I think it's fun. I tried to make it really engaging so that you would learn the content rather than just like a checkbox. Yep, I did my class. I wanted more than that. And I am actually adding something to the class right now about intermittent auscultation. Let me know what you guys think if you think that would be valuable information for you to have in the class. I'm going to make myself a note. I'll work on that next time I work on the class. Chelsea, your urologist made it seem like you don't have many options. Well, they can't leave a stone in there that's blocking the urine. Um, they can't just leave it in there, especially if it's like stuck in the ureter, because then urine can back up into the kidney and cause issues. So you might want to connect your urologist with your OBGYN and see if they can hash it out. If the stones are too big, usually they find on ultrasound, I think. Um, Kansas Family Life, did you see my comment? I don't think so. If I skipped it, then unless it was about getting pregnant. Not stuck, just dealing with kidney pain now. Well, hang in there, my friend. I mean, it's so hard because you're early too, and I didn't have them until after probably 20 weeks or so. Tachycardia and pregnancy all test normal. So it can be really normal for your heart to like all of a sudden flutter a little bit in pregnancy. That's usually due to the increased blood volume throughout your body during pregnancy, and your heart's just sort of managing that. But you do want to make sure that your doctor is listening to your chest at your appointments to make sure that you don't have like a heart murmur or any cardio issues, heart issues, or lung issues involved with it. Because cardiomyopathy can happen during pregnancy, and sometimes people just end up ignoring it, thinking it's that, like what I talked about before, especially if you are a black mom. And I don't know what you are, but yeah. Um, if it happens frequently and you are black, I would probably ask to see a cardiologist, but that's me. How long should I wait to get pregnant after ectopic pregnancy? I am not sure. You're gonna have to ask your provider on that one. He said, "Thank you. You're welcome." Hey, man, everybody wants to know on how to get pregnant. Guys, I am the pregnancy nurse. Like, you're already pregnant when you see me. See. Strawberry shortcake followed the creator. Thank you. I had my Tammy ultrasound today. Was upside down. Is that okay? Yeah. Baby in the beginning is just going to be like all over the place. So not unusual at all. Not fun always, but not unusual. Um, any more pregnancy questions? At the beginning of this live, I was talking about intermittent auscultation, which is where they just listen to the baby kind of every once in a while. And I think it's a really helpful article if you're thinking about wanting to go now. So curious is how to deal with migraines while pregnant. Can I still take my medication in the first trimester? Talk with your provider. That's something you should be able to call into the office and they can answer you. Tell me how I can get this baby out. They're really, I mean, get an induction. That's a really only proven way to get, um, yeah. Hey, Sally, I'm sorry they won't push your comment. Is it about lady bits? Can you use like another word? First time mom, what are the downsides of the epidural? Um, I mean, a lot of people talk about the downsides of the epidural, and I'm not sure that I agree with all of them. Some people say that it limits movement. I don't think it has to. If you get the epidural and you tell your nurse, I would still really like to move. And especially if you have a partner that's willing to help her help you move, and you're willing to put in the effort that you can put in, still very doable. We can still peanut ball you. We can maybe even put you on hands and knees if you still have some, uh, yeah, some movement. So, you can get a spinal headache. That's just part of the downsides of the procedure. You can, I mean, there are risks to an epidural infection, problems like that. But and then some people say that it takes longer in labor. They do say that there is an increase. There can be an increased time in pushing. I do think that that's true. Sometimes it takes a while to get like call it your sea legs under you, in order to be able to push out the baby. But I think all of that can be mitigated. And I also really think you can sort of tailor your epidural to what you want. So if you find that you're super numb and you can't move at all, you can ask them to turn it down. We have it on an IV pump kind of a thing. It's not an actual IV pump, it's an epidural pump. But we can turn it up, we can turn it down, depending on what you want. So even if you want it up to take a nap, and then you'd like us to turn it down so that you feel a little bit more pressure, and then if you want us to turn it up a little bit, we can do that. It really can be tailored to what you want. So if you want to be able to move more, we can limit it, things like that. Isabel said the epidural messed me up bad. I wouldn't recommend it. Nobody loves to hear this, but the studies show that people with an epidural versus the people without an epidural have the same amount of back pain after a month after childbirth. So I think that pregnancy, having a baby, living with a baby messes up our back. Leanne said, 39 weeks, 4 days pregnant, baby still had a 50% 2 centimeters dilated. What should I do to get him down? I'm a big fan of the mile circuit, doing lunges, peanut ball, but there really is only so much you can do. So sometimes I just say chill out and try and rest. Pregnant my second baby, how true is it the second baby will be bigger? I'm not sure that that's always true. I haven't read the studies on that. Kelsey said she loved her epidural. I love that. Most of my patients actually really love their epidural. Is there anything I can take instead? Savage Queen, let's see your first one. So I'm not sure. You mean instead of the epidural? Isabel said, forget back pain, it was labor that it messed up. It may or may not. Hard to say. Will tachycardia interfere with a natural birth? He said. It shouldn't. I've never seen anybody have to get an epidural because of tachycardia. I don't know that it would help that. So talk with your providers, though. There might be something I'm missing. My dad is a chiropractor. I was adjusted my pregnancy. I never had back pain. Yeah, might be. Missed my cycle with a faint pause and then started bleeding. No pain. My test started and faint again. I don't know. I'm not big on pregnancy tests. Isabella, I don't know that the mouth circuit you have to do for a certain period of time, just till you get tired of it. Because if you're miserable doing something, that's not gonna help. Holly said, "Do you know anything about a fetus having pericardial effusion?" I do not. That's a really specific thing you'd have to ask your provider. Is a baby size based on genetics? I'm scared of having a big baby. It is, and I did ask the boys I was dating in college how big they were because I was doing a labor and delivery rotation. Just fun things about nurses. Yeah. In case we haven't met, hello, hi, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth. I know a lot of you guys are like, "Oh, I don't wanna spend time in a class. I'd rather just, like, flip through TikTok." But I gotta tell you that if you really wanna know the beginning to the end, you really are gonna do best with taking a class. Plus, you can take it with your partner. It's fun. It's available 24. You can get the basic class, or you can upgrade to the bigger class that has nutrition, baby care, baby sleep, cleaning. It has everything you need. I call it your one-stop shop for, birth prep. So come join me in there. But will I get I don't know much about pregnancy tests, my friends. How much is a class? Haley, great question. It starts at $89 for the basic class, and then it's $197 for the class that includes breastfeeding, baby nutrition, I say breastfeeding, brighter communication tips. It talks about elective inductions, has so much stuff in it. Um, yeah. So if you guys have any other questions, please be sure to ask in the comments. I recommend that people do practice as they head into their second trimester and then get solidified by their third trimester, which is about 27 weeks. However, even if you're due this weekend, or even if you're due today but not in labor, you can still take the class because the main class really only takes about 3 hours to get through. I will say that I'm a bit of a fast talker, which is how I am here. And so I really try to get through the information ways that I have to help us understand it a little bit. So Leanne's Leanne's family said she had 5 precipitous labors. It's insane having my 6th soon. Yes, it can be really scary, and some of my patients with the most birth trauma have been precipitous labors. I will say that a precipitous labor, which I tell myself as I'm delivering the baby, as you're like in the wheelchair coming up from labor and delivery, those have the best odds of being the safest because Mother Nature is working magic and baby's just going to come out fine. For us, the thing we're really concerned about is baby getting stuck with the shoulder or something like that. And most often that does not end up with precipitous births. My brother and my husband were both 8-pound babies, so I thought my son would be about 8 pounds. He was 9'9". Yep, it happens. I mean, you can only guess. Nietzsche, OBGYN clinic nurse lives to keep me learning. Oh, I'm so glad you're here. Haley said, "Is the ability to lactate based on genetics?" I don't know, Haley. I actually don't get any. I mean, I get drops of breast milk, but I never could get anything more. I don't know if my mom could breastfeed because she didn't even try. Because back in the formula age, uh, yeah. So I think the best thing to do is give it a try and see how it works for you. I always send all the breastfeeding questions to my friend, the breastfeeding mama. She's here on TikTok. She's on Instagram. There's a website. She's actually the one that teaches the breastfeeding class in the online prenatal class for couples. It's just a basic breastfeeding class. She also, though, does prenatal breastfeeding consults. Her name's the Breastfeeding Mama. She'll do virtual consults to just kind of explain things, walk you through stuff, maybe show you how to use your pump if that's something of interest to you. So, Haley, that's a good option as well. Is it okay to sit on the couch with the back on the pillow, or do I need to sit sideways? No, Corley, the only thing we used to say not to lay on your back. I think we still say that is because you can cut off your aorta when the uterus like lays on it. However, if you were to cut off your aorta, your body would send lots of signals to you to move, like your ears would ring, numbness in the feet, things like that. So um, we would prefer that you have a little tilt when you're laying on your back, when you're sitting up or whatever you want, because your uterus will shift down, not onto the aorta. I mean, the aorta is a firm blood vessel. It's not like real squishy, but yeah. Isabel said she's already lactating. She's only 35 weeks. Is that okay? Yeah. I have a whole post on leaking colostrum that you might be interested on the pregnancy nurse. Would that be a reason I hemorrhaged? Only the last two I've had more bleeding than they'd like. Genetically, I'm not sure. I didn't require a blood transfusion. Yeah. I don't know if you're pregnant now, the King's family. Oh, you had precipitous births. Precipitous births can hemorrhage a little bit more because things happen so quickly. So it's just something to let them know when you get to the hospital. I've hemorrhaged before, so they can grab the misoprostol and maybe put it in to stop anything. What is some outdated pregnancy information that most people still believe? Well, aspirin during pregnancy is a new one. You have preeclampsia, and I know a lot of moms are like, "No, you're not supposed to take that." But aspirin can really help reduce your risk of preeclampsia. So that's something right there. Yeah. Goodness. Do you live far from your hospital? That wouldn't be fun. My husband would not like that. I would probably like that because I feel like I'm always in labor forever, but yeah. All right, I think we've gotten through all the questions. We've had some fun ones here at the end. I do, if you guys are like, tell me more about precipitous labors, I have a post on the pregnancy nurse. If you just type in like fast labor, it will come up. A lot of people don't know how to type precipitous, including me. But if you want to know more about that, I would tell you to go check out that article because I think it's super helpful. Okay, I think we've answered all the questions. Thanks. Let's see. For first time mom, how long can I expect to be in labor? It really just depends. Everybody's different. The textbook case, once you start active labor, is a centimeter per hour plus 2 hours of pushing. So that means once you're starting to dilate, like pretty frequently, not just that you were 1 centimeter in the office. But that's the textbook case, and no babies have read the textbook because I wouldn't want to push out the textbook. So I opt for an elective induction, no Pitocin required because of distance. So Canes, do you what do you yeah, I would do that too. Eli Pepper said, "What made you decide to go this route in nursing?" Well, Eli, so my first job, it was working in a pediatrician's office. I did telephone triage for parents. I worked like the phones, and then I also worked like night emergency clinic, helping the doctors with like stitches and stuff like that. And then I actually went into pediatrics. I did my capstone in labor and delivery, which I really enjoyed, but then I went into geriatrics in hospice. And then moved to California. I had several and I wanted labor and delivery. So that's what I picked. Okay, yeah. Plus you have that fast labor thing. So all right. Well, thanks you guys for joining me. If there's any more questions, I'd be happy to answer them. Remember, I'm Hillary. I am the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. And I am the creator of the online prenatal class for couples, which is the best way for you guys to learn about your birth and everything about it. Um, Eli's hoping to become a nurse midwife. That's awesome. Lovely Ray said, I'm 35 weeks having breast and hips contractions. When should I go in? You got to ask your I mean, if you're having just Braxton Hicks, then none. But if you feel like they're getting more painful, then I would. Great. Thanks for joining me, guys. I hope to see you around. I've been trying to do lives like this time every day, although it just depends. It's summer, so it's kind of hard to know exactly what's going on at my house. I hope everybody has a good day, and we'll talk to you later. Bye.